As you heard, my name is Assam Musonza from Zimbabwe. A very good day to you all, colleagues. The name of my topic is the emerging patterns of prostate cancer in Zimbabwe. Right, just a summary of what we have done is to look at what is prostate cancer. Prostate cancer is carcinoma of the gland called prostate, which you find in men. And the reason why we really tried to look at this problem was because we find that in Zimbabwe there has been a massive increase in prostate cancer ever since the turn of the century. We wanted to look at what is the pattern like, who is affected, what could be causing this. Now, all over the world, prostate cancer has become a real major problem. It's the second leading cancer in men, second to skin cancer. And in Zimbabwe, prostate cancer has become the leading cancer and cause of death in Zimbabwean men. It was found out that prostate cancer is a major health problem in the Zimbabwean context. Because of lack of resources, our main screening test, besides the digital rectal examination, is protein prostate-specific antigen. Now, this test, despite its low specificity, the test still plays a major role in the detection of prostate cancer in Zimbabwe. In this particular study, we looked at 176 patients whose age ranged from 27 to 92, who came in for the screening test prostate-specific antigen. The mean age of that group was 68. We also found out that there is need for improved health budget and public health education in Zimbabwe then to realize the problem of prostate cancer and what they can do about it. It was also found out that prostate cancer is a health major problem in Zimbabwe. Now, so what? Because of this high prevalence, which was actually detected by our Zimbabwe National Cancer Registry report in 2012, we decided that this was a starting point to actually look at the pattern of what is actually happening as far as prostate cancer is concerned. Just as an example, since 2004, prostate cancer cases have increased by a whopping 104%. This again is information that's emanating from our registry. Now, looking at this emerging pattern in Zimbabwe would enable us to compare with others and provide a framework for further research on the risk factors of prostate cancer. You might be aware that all over the world, African Americans have got the highest incidence of prostate cancer. What we are finding here is obviously because we share that genetic aspect, that it might also be the case in Africa, specifically the case in Zimbabwe. And as far as Zimbabwe is concerned, we think that there appears to be a trigger which has made this particular problem such a major problem in our country. Right, the genetic predisposition of prostate cancer needs to be thoroughly investigated. Changes in lifestyle might explain the certain increase in prostate cancer cases in Zimbabwe. And because of that, we actually try to compare the incidence or the cases from these small populations that we looked at. People who come from rural areas probably have got a different dietary intake compared to the urban population. The use of the prostate-specific antigen tests and probably greater awareness of the disease could explain the increase in the number of prostate cancer cases. Because now people with the internet, people are getting to read about prostate cancer, and some of them present themselves just to be screened. Now, what type of methodology did we use in this particular research? We used a retrospective cross-sectional study, which was basically using secondary data which was obtained at a small medical facility in the Midlands part of Zimbabwe. 176 outpatients who came in. I said some were coming in just to have a screening test. Some came in because they had symptoms to do with the prostate or the urinary system. Now, of these people, in 176 patients, 26 proceeded to have biopsies done. Their histology reports were retrieved and analyzed as well. So there was an analysis of 176 prostate-specific antigen results plus 26 biopsies histology reports that were done. The data was analyzed using GraphPad Prism 6 software. Now let's look at the results that we obtained from this particular study. Like I indicated, we used GraphPad Prism 6 software. And of the 176 patients that we analyzed, 112 of those patients had results that were within our reference or the internationally accepted NOF reference of 0 to 4 nanograms per milliliter. 14.2% of those patients were confirmed by biopsy to have prostate cancer. Of the 176 patients, we had 22 patients who had values that lied between 4.1 and 10. 16 of those patients had values that were greater than 10 but below 20. When you look in percentage terms, 63.6% of patients had normal values. And 38 of those patients obviously had values from 4 to 20. And you can see the distribution of the results. Those were the PSA levels of patients that had biopsy-confirmed cancer cases. And what is of particular worry there, you can see we have got more patients, a few patients who are between 60 and 50. And those, that's another diagram showing you the PSA results of all the patients that we had. The mean value of those patients being 9.05 nanograms. Now, with those results, the discussion, we found out that prostate cancer is a major health problem in Zimbabwe. Despite the low specificity of the prostate-specific antigen, this test, as far as our situation is concerned, still plays a major role in the detection and, of prostate cancer, also deciding who of the men certain levels of PSA proceed to have a biopsy. Like I indicated earlier on, the age of those with confirmed prostate cancer seems to be going down. Those are the references that we looked at. There's more, but those are just a few of the references. And in conclusion, prostate cancer is a major problem in Zimbabwe. Just looking at a small sample, the PSA test still plays a major role in the detection of prostate cancer. Although the study could not determine the levels of prostate cancer in the 4.1 to 20 PSA range, because most of those patients did not proceed to have biopsies done. The reason being that there is obviously still a phobia to have invasive procedures, especially if the symptoms are not that much. So you will find that people who are likely to be checked whether they have one because of their slightly elevated PSA levels will probably opt to wait and see what happens. There is need for improved health budget and public health education in our country to look at this particular disease. There is also need for public health education to Zimbabwe on prostate cancer. We also think that cohort studies are essential, from investigation to treatment, to actually see where this disease is coming from how far we are going treatment schedule. Comparative studies of lifestyles of those people who do not have cancer, proceed to have cancer, also needs to be done. We also require new and better diagnostic tools to detect prostate cancer early enough, because we need to detect early if we are going to really be successful in terms of treatment. It is also quite apparent that most of the people who presented with or were confirmed with prostate cancer presented quite light. Thank you very much for your attention.